Good morning. Welcome to our live stream of spine surgery. It is June 12th, 2025. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. Our patient is a Floridian. She comes to us from Central Florida, and she has debilitating lower back pain that hurts. It bothers her every day. It hurts her to do anything. She even had a microdiscectomy done. Can you guys see the scar here, Henry?
Yes, we can.
So she had a microdiscectomy, still has back pain. Microdiscectomy did not fix anything. She comes to Duke Spine Institute now in hopes to get rid of her back pain. When I examined her on our MRI review, she had two areas of pain. One was here, L3-4, and the other one was here in her buttock. She has a piriformis muscle tear deep in the buttock on the right side. We're going to do a piriformis release next. We're going to start with her Duke laser disc repair at L3-4. All right, if you have questions, feel free to type them up and Henry will relay them to me. Meanwhile, I'll get started by placing a needle into the spine. Perfect. You can see from our picture there that the L3-4 disc, Jordan, is right up there. You want to start at the sacrum. We're going to call that the sacrum there, and then the first disc is L5S1, the second disc is L4-5, and the third disc is L3-4. Our target today is L3-4. We're going to be fixing her L3-4 disc. Shot? All right, so I have to get to that disc. I'm going to aim my needle there. And for those of you wondering, there are about 30 specific different causes of back pain. This patient has 2 out of 30. And her cause is the L3-4 disc herniation, degeneration, along with the piriformis, AP. So Henry, while we're getting our needle placed, why don't you want to do a discogram? Why don't you show us the 30 different causes of lower back pain? The disc is the first and most common cause.
Hello, how are you?
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. You can see from the video that there are 30 very specific causes of chronic back pain. And Duke Spine Institute, we're world's leaders in diagnosing the cause of back pain in patients, and we do it through an MRI review process where we have a virtual consultation on Zoom. In 10 minutes, I can tell you exactly what's causing your back pain. And we can, of course, fix all the causes of back pain that there are. So we have just done a discogram while you guys were watching the video at L3-4. And sure enough, that's where her pain is coming from. That's what the C stands for concordant. The pain was a 10 out of 10 pain at L3-4. So when I injected a little bit of dye in the disc, it activated the pain fibers in the back of the disc that were aggravated already, and it shot her pain up to a 10 out of 10. Now, if I do a discogram at a different disc that's not painful for her, it won't give any pain at all. It's a negative discogram. So painful discs are positive on discograms called evocative discography. That's what we just did. Now I made my incision. The whole surgery, that's how much blood we're going to lose. She's a patriot. Red, white, and blue. She's an American patriot, so it's right there, proof of it. Okay, she bleeds the colors of the American flag. You can see the incision here is 7 millimeters. Now the old incision she had done before, right there, for her prior microdiscectomy is, 30, let's just say 35 millimeters. So 7 millimeters, 35 millimeters, and this surgery didn't even work for her. That's why she's having to have surgery again. She had this done elsewhere at another facility I think in Tampa or Orlando, and it didn't work. So now we're going to fix her disc and fix her disc pain. All right, any questions from the audience?
Yes, we have a couple of questions.
Sean?
This first one coming from Faisal on
Sean?
Facebook.
Faisal, what a surprise, Faisal.
Faisal asking, morning doctor.
Good morning.
Is there a procedure code for your disc laser repair surgery? I hear a few insurers may cover the surgery. Just wanted to check if mine does. Thank you.
Yeah, the procedure code is called the CPT code, current procedural terminology code, and it's 22899, 22899. It stands for unlisted spine procedure, and what it means is any procedure done on the spine that doesn't have a code itself currently, for example, any new procedure would use the same code. So it's not specific for the Duke laser disc repair. It is a general code for any unlisted procedure. That's a spine procedure that's, say, new without its own CPT code. All right? All right, very good. And you're right, we do have insurances that cover the procedure. We've had almost 200 insurance payments now in the last 4 years. Insurance covers, we get insurance coverage, easily get insurance coverage on about 5% of the surgeries. 5%. So 95% we have to fight the insurance companies and try to get them to pay. All right, great question. Thanks, Faisal. So you watched the video we just showed you on the 30 different causes of back pain. And the most common cause by far is a disc injury. What does disc injury mean? Well, disc injury means a bulging disc, herniated disc, ruptured disc, protruded disc, extruded disc, slip disc, spondylitic disc, degenerated disc. All of those terms mean the same thing. They all mean exactly the same thing, which is disc injury. Now, unfortunately, over the years, disc injuries have adopted many, many different names. Those names I just told you. 10 different names for the same thing. Now, some of you may be saying, Dr. Duke, you're wrong. A slip disc is not the same as a bulging disc or a herniated disc, but it is. I promise you it is. It's no different. All of those conditions are the same. Also, you may think spinal stenosis causes back pain, but it does not. Spinal stenosis never, ever, ever causes back pain. Okay? Ever. Spinal stenosis can cause, and doesn't always cause, but can cause, when it is causing symptoms, it will cause leg weakness, leg numbness, and tingling in your leg, like pins and needles, like your leg fell asleep. That's all spinal stenosis causes. But there's a lot of misinformation out there on the internet, among doctors, among nurses, among physical therapists and chiropractors. They all think spinal stenosis causes back pain, but it 100% does not cause back pain. All right, any questions?
Yes, we have a couple more questions. Next one is coming from Lanu on YouTube.
All right, welcome, Lanu. Good morning.
Asking, can a herniated disc patient play softball?
Yes. Herniated disc patients can do everything they want to do. It just hurts, or they'll have weakness in their leg that gets worse. I would never recommend a herniated disc patient play softball until their herniated disc is fixed. Otherwise, they're going to make it worse. Thank you. Good question. So let me get back to our 30 causes of back pain. We talked about the disc injuries. They are the most common cause of chronic back pain. Disc injuries account for 85% of primary cause of back pain. That means the main cause. Many patients, though, that have chronic back pain have more than one cause. They can have 2 discs, 3 discs, or facet joints as well. The second most common cause of chronic back pain is facet joint arthritis, facet joint inflammation, basically. And to get facet joint inflammation, you just need an injury to the facet joint. When you injure your disc with trauma, you also injure your facet joint. A disc injury happens from a sudden and forceful movement of 2 vertebrae next to each other, and the disc between them becomes damaged through that forceful movement. The way the disc gets injured is 2 things happen. 1, the annular wall rips open, called an annular tear, and 2, the nucleus pulposus located adjacent to the tear just inside the tear becomes smashed, shattered, and fragmented. And then that begins a process where the fragments can push out through the tear, through a path of least resistance with any kind of normal bending and lifting. And that ends up causing a herniation, which then ends up causing inflammation within the wall of the disc called annular inflammation, which is what this patient has. And 85% of all patients with chronic back pain, the main cause of their back pain is inflammation within the annular, posterior annular wall, right where the tear is inside the tear. And that's what the Duke laser disc repair does. It cleans the tear with a laser to get rid of the herniation, get rid of the inflammatory tissue, and get rid of the pain permanently. It's a permanent fix to back pain. I pioneered this technique here at Duke Spine. I'm the first in the world to discover the causes of back pain and how the disc itself causes back pain. It's not inflammation inside the disc, it's inflammation in the wall of the disc, which is still part of the disc, but not the center of the disc, okay? The center of the disc has no pain fibers, no innervation. The center of the disc is called nucleus pulposus, and it can never be painful. Only inflammatory tissue can be painful, and the way you get inflammatory tissue is through inflammation. So to get inflammation, you must have a blood supply. To get pain from inflammation, you must have nerves. The blood supply for disc inflammation comes from the outer annulus, and it comes from small arteries that run along the outer annulus. These arteries feed the wall of the disc called the annulus, and they supply blood and inflammatory mediators to the outer wall. So when you get a tear in the wall, you get a herniation into the tear. The inflammation that ensues afterwards causes an ingrowth of new little unmyelinated nerve fibers called type C, type 4 fibers, or class C fibers, same thing. And these are pain fibers. They're somatic afferent fibers, so they are projected to the primary somatosensory cortex of the patient's brain, which is a highly localized area of the brain where the patient can map out exactly where the pain's coming from, which is why back pain is highly localized. It's those projections to that primary somatosensory cortex that allows the patient to identify exactly where their pain is. All right. We're just working on this tear right here, and I'm trying to pull out pieces of herniation, like that piece right there, but they're stuck to the wall of the tear. The tear is right in the middle of the wall. The tear is real, it's there, you can see it, and these herniation pieces are stuck to the wall. And what sticks them to the wall is scar tissue. What causes scar tissue is inflammation, chronic inflammation. Chronic inflammation means inflammation lasting longer than 2 weeks. Normally, inflammation is part of healing of any body part, and it lasts for 2 weeks. But when you have inflammation that keeps going on and on and on and on for months and years, then it's called chronic inflammation. Chronic inflammation is not normal, and it's not part of the normal healing process. It is very abnormal. This is all pieces of herniation coming out here. By the way, we just tested her disc, for those of you who missed it, while you guys were watching the video. And this disc is causing 10/10 pain. And it's called concordant pain, which means it's the same pain she gets every day. So we know for sure that this disc is the cause of her back pain, because she told us that just now. There's more tear right there. We're going to work our way out the tear, starting at the base, working our way to the periphery. You can see more herniation stuck in the tear. Once again, nobody taught this technique to me. I had to pioneer it because I found that by doing this, we were able to cure back pain. So we've been doing this surgery now for 19 years. As a matter of fact, 19 years, almost to this day. It was June of, I want to say, 2006, yeah, June of 2006 when I did my first endoscopic Duke laser disc repair. So we've been doing this surgery for 19 years. We've treated over 2,650 patients. And our results are 99.6% on average per patients. They report their pain relief, 99.6% average pain elimination. Any questions?
Yes, we have a couple more questions. Next one is coming from Sandy on YouTube.
Sandy on YouTube, all right.
Asking, can severe cervical nerve impingement cause vertigo?
Can severe cervical nerve impingement cause vertigo?
Correct.
I think so. I think it probably could. I mean, vertigo, true vertigo is where the items in front of your visual field in the room, like chairs, desks, people, are literally spinning from side to side. They're spinning around. That's true vertigo. Now, dizziness is when you feel like your head is dizzy, but things are not spinning, truly spinning. To get vertigo, your eyes have to move side to side. They're called saccades. All right, you have to have your eyeballs moving left to right, typically. And what causes that is an abnormality of the vestibular system, which is a system in your brain of nuclei and nerves that basically oversee your position of your body in space. And so when it's gone awry, things will start to move. Your visual field will move because your eyeballs are moving. Your eyeballs are moving left to right or up and down, typically left to right, right to left, that kind of thing. So could a pinched nerve cause vertigo? I mean, probably not true vertigo, but it can cause what you would perceive as vertigo, what patients call vertigo. So that's why I'm agreeing that it could do it, even though it's not true vertigo. So technically no, but dizziness, feeling of imbalance, yes, but not true vertigo. All right, there's your tear right there. You guys see it? The blue stuff is the herniation stuck in the tear. The white stuff is the annulus and scar tissue. The orange stuff is calcification inside the scar tissue. All that's abnormal. Once again, this whole technique and the whole concept that the tear is the source of back pain was my discovery. I'm Dr. Duke Majan, CEO and founder. It wasn't something that's generally understood around the world. I had to figure it out, and we did so over 19 years ago, basically. I've been trying to raise awareness so that people can get fixed. They don't have to live with back pain anymore, but unfortunately most doctors, nurses, therapists, they don't want to accept the truth for what it is. They just want to keep believing what they were taught in school, which is that there's no cure to back pain. There's no cause and no cure. So just got to do therapy and take pills, do shots, because nobody can actually cure it. But that's not true anymore. We've been curing back pain at Duke Spine Institute for actually more than 20 years. Now, originally we were doing it with fusions. Fusions will cure back pain if you fuse the right areas. Most doctors can't figure out where the right areas are to fuse. So a lot of fusions don't work because the doctor's fusing the wrong place, or they're fusing not enough. But nobody wants fusions, and nobody should have to have a fusion for back pain. Okay? All right, we'll take some more questions, and then let's show the video on microdiscectomy. Well, I'm almost done here. I got about 5 minutes left. So let's take another question or two and then show the video.
Copy that. 2 more questions. This next one coming from Carolyn on YouTube asking, I have severe stenosis between the L3 and L4, getting surgery next week. What are the risks? How risky is surgery for spinal stenosis?
Yeah, great question, Carolyn. Thanks for asking. The truth is the risk of surgery is directly related to your surgeon and the equipment and the team of people that help them. So I would say an average risk for your procedure is probably 30% chance of a complication. but if you had it done at Duke Spine Institute, it would be 1%. So the reality is where you go for your surgery makes a big difference on the result of your surgery. Period. Hands down. I don't know how good your surgeon is. You might think they're good, but the truth is there's a lot of bad surgery and a lot of bad surgeons out there that don't know how to do surgery properly. They put patients at risk. They get complications. If I were you, I would go for the sure thing if you're able to. The sure thing is go to a surgeon who is really, really, really good. Now, I don't know too many of them that are really, really, really good, because there's so many ways to do a laminectomy, right? And the complication rate for laminectomy among most spine surgeons is very high. And you're going to end up having to come back and get a fusion if they mess up, which a lot of them do. And they do it on purpose, by the way, because they want you to have to come back and get the fusion. Laminectomies don't pay surgeons much money. We get under $1,000 for a laminectomy, but for a fusion, we're going to make $15,000 easy. So most surgeons will put patients through a laminectomy just to weaken your spine so that you have to come back and get a fusion within a year or two. So it's kind of like an investment. They're investing their time doing your laminectomy so that you'll come back and get a fusion. With the laminectomy, they're going to take away the bone in your spine. They're going to take away the ligaments that hold your spine together. So what happens is afterwards your spine starts to wobble and get loose, and then you start having more back pain. And then you're going to come back and beg for a fusion. That's what happens. That's why we don't do laminectomies anymore at Duke Spine. We stopped doing them because they don't work well, first of all, but there's much better treatment. This is a better treatment here. Laser endoscopic surgery is the best treatment. Laminectomy is an old, 100-year-old surgery that should not be done anymore, in my opinion. But a lot of doctors still do it for the reasons I just told you. You may not want to hear that, and that's fine. So when you ask what the chances of risk, the risks are very high for a laminectomy, even with a good doctor. Very high that you're going to come back and have to have a fusion. That's very high. The chance of having a complication like spinal fluid leak, bleeding, infection, nerve damage, dural damage, blood clots, pneumonia, heart attack, stroke, that risk is probably somewhere around 10%, 15%. If you go to a good spine surgeon, it's going to be around 50% if you go to a 50% or lower qualified spine surgeon. Remember, there's no quality standards for spine surgeons. You just have to be accepted from medical school into a residency for neurosurgery or for orthopedic surgery. And what you do in the residency, all you got to do is graduate. And they graduate everybody unless you're like crazy. And then they try not to graduate you. But they graduate everyone no matter whether they're a good surgeon or a bad surgeon. That's just the way the system is. So just because your doctor graduated doesn't make them a good surgeon. I know a lot of really, really bad surgeons out there who are technically bad, but also they don't make the right diagnosis. They make the wrong diagnosis for quite often. But the reality is that spine surgery pays these surgeons when they do laminectomies, when they do fusions, discectomies. The financial reward is very high. So you have a lot of doctors who shouldn't be doing spine surgery, even though they're not good at it, and they're doing it because of the financial rewards, not because they're going to help the patient.
They don't improve. 20 years later, they're still back. I mean, ones that were back 20 years ago.
Yeah, exactly. Yeah. That's just the honest truth, all right? I'm sorry, you probably don't want to hear that, and I'm not here to tell you what you want to hear. I'm not one of those woke people that want to tell you what you want to hear, okay? We've been broadcasting surgery now for 11 years, live, and I have never been that kind of guy. I'm not going to sit here and, as we say, proverbially blow sunshine up your ass just because I want to make you happy with me. Frankly, I don't care whether you like me or not, but what I do have to do is go to bed at night and know that what I tell people is the truth. So I have to like myself. And I won't like myself if I lie to people. if that makes any sense. Hopefully it resonates with you. But the reality is, you don't get a laminectomy because it's unnecessary and it's a bad idea. It's an old surgery. Laminectomy was originally done for spine tumor. Victor Horsley, he was a neurosurgeon, and Dr. Horsley did the first laminectomy. What year did Horsley do the first laminectomy, Henry? Can you look that up on Google?
Copy that.
Victor Horsley, first laminectomy. I want to say it was a long time ago, maybe over 100 years ago, right? So laminectomy was supposed to be done for tumors of the spine, but we started doing it for all kinds of other stuff. Honestly, it pays very well. It's paid well for surgeons for many years. The insurance companies used to pay $10,000 to a surgeon for a laminectomy. Of course, they've cut that number down now. But
1887.
so 1887. So we're talking about what, 150 years?
Yeah, almost 2 years. By 2027, it'll be 150.
150 years. So a laminectomy has been around for 150 years, was originally done by neurosurgeons for tumors. So why the heck is your surgeon doing it for spinal stenosis, right? And that's because they're recommending an old surgery to you that's not going to work, and you're going to end up with instability and needing a fusion. But before you get the fusion, I'm going to tell you what they're going to do. They're going to send you to pain management. Their buddies over at pain management are going to treat you with shots and pills, and you're going to be miserable with pain for a long time. That's what I've seen. I see it all too often. Okay? So don't do the laminectomy. Come and do this surgery, the laser surgery, and avoid invasive surgery that doesn't work. All right? That's my advice to you. All right, let's show the audience the microdiscectomy. We're almost done with this disc. Things are going very well for this patient. Look at how big this tear is, right? All this is tear, and I've been cleaning it with the laser. By the way, for your reference, that glass tip there, the little tip sticking out, is 1 millimeter, 1 mm wide. So it's very, very, very small. And I'm just working on pieces of herniation, trying to get them out of here. Let's show them the microdiscectomy.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
From that video of the microdiscectomy, you can see what this patient actually had done. She had a little bit different microdiscectomy, but in essence, it's the same. It's basically a procedure that removes, with a grabber, removes some bone and ligament. Unfortunately, taking that bone and ligament out should not happen. It's not going to help the patient. It makes the spine unstable. All right, we'll take another question or two, and then we're going to be done here. As you can see, this is the end of the disc right here. We're now in the epidural space, and I've cleaned up the entire tear. I've removed all the herniation except a little bit, and I think she's going to do really, really well because we tested this disc and we verified that it was indeed the source of her back pain in the spine, which he had. She also has piriformis, which we're going to do next. But let's take some questions before we go offline, and we'll come back for the piriformis.
Next question coming from AAKK on YouTube.
All right, nice to hear from you again, AAKK.
Asking, excellent visualization of the tear. How do you know how do you discover how to get your Duke spine blue to specifically stain the tear/herniated nucleus and not the healthy nucleus/annulus?
Yeah, great question. So the dye that we use is a vital dye found in nature, okay? And the property of that dye is that it stains to acidic, that's spelled ACIDIC, acidic tissue. So the normal nucleus, which is white, is not acidic, it's basic. So only way to get acidic nucleus is through degeneration. So the action of inflammation on that nuclear material for a long time causes it to turn acidic. Therefore, the pH of the tissue drops down and it binds to the dye. I got probably 30 seconds left here. Okay? Good question. Hopefully you understand the answer.
At this moment, no current questions, but we do have a comment coming from Carolyn once more on YouTube.
Yeah.
Saying my stenosis is causing a lot of numbness in both of my feet.
Yeah, if that's the case, then it is due to the stenosis. Numbness in the feet can be due to stenosis. I would recommend you get a nerve test to make sure you don't have neuropathy, though, because neuropathy numbness will not get better with spine surgery. So verify that before you have your surgery. Ask your doctor to do a nerve test and make sure you do not have neuropathy. Neuropathy numbness will never get better with spine surgery. We don't ever recommend spine surgery if the symptoms the patient has is due to neuropathy. All right? Just do that for yourself. All right, guys and gals, we're pretty much done here. So you can see the epidural space right there. We're outside the disc and everything looks good. That's where the tear and the herniation were. They're gone. We're done. We're going to end the stream. We're going to come back for a piriformis release.
No current questions.
Go ahead and end the stream and we'll be back for a right piriformis release.